How do you determine the noise from the value in the digital space? So you just finished speaking at the Becker's conference, and about 10 vendors surrounded you with their cards and whatnot. But so one of those might be awesome, and 9 of them might just be noise. How does your organization do that?
I think healthcare is in such an interesting time right now, and in order to separate the noise or the signal from the noise, you need to separate the strategy from the things that are opportunistic. Right. And as I think about it and look back, our core, our system just went through a big Epic implementation, as many have. And to leverage that investment, you have to understand the roadmap and the development that's going into some of your core platform vendors. And for my money, if it's anywhere near that core, that's our answer. And that's really the strategy that we're going to employ, is do not invent what you don't need to invent.
So you're encouraging people, if my EMR provider does this, go somewhere else.
If my EMR provider does this, I would tell people in the startup space this as well. If you're trying to compete and go after Epic clients with functionality or tools that Epic has or will be providing as part of their core in the future, you will not outrun that bear, and they will supersede your functionality at some point in the future. And the fact that it's all integrated is always going to trump whatever incremental functionality add. So not to be disparaging and say, don't innovate, but innovate in the right space. Innovate in those spaces that don't have a core adjacency to the stuff that we've all spent millions of dollars putting in and implementing, and we're now trying to optimize and get our value out of. Help us in those areas where you can add on top of the value and start to think of it differently. If you want to compete with Apple, you're Samsung, and that's probably 1 or 2 or 3 vendors in that space that are going to be successful. However, if you want to be an app developer on the App Store, there is a huge marketplace for you. Just recognize when you're on the platform and when you're actually selling an app.
Yeah, it's that's really fascinating. I work with a lot of startups, and they say, I don't understand why this health system doesn't buy my stuff. They need it. It's absolutely necessary. And I say, well, do you realize it will take them probably 18 months to implement it? Just from a contracting standpoint, it's going to be 6 months.
Contracting, implementation, change management, understanding the workflow integration points. And then you look at whether that problem is actually the biggest problem in the health system.
Right.
Maybe a problem, but it doesn't mean it's the biggest problem. And we all have finite resources in terms of money and time to spend on this stuff. And we've got to be judicious about how we do it.
Absolutely.